Labor can be very distressing and you will often need some pain relief. When you're in early labor, you may use a TENS machine, mobilization, adapting different positions and paracetamol. When you're in established labor and you're admitted to the maternity unit, you have some more options according to the stage of labor you're in at the time. Your midwife or your doctor will advise you which option is best for each stage. The options you will be offered include water, bath or birthing pool, gas and air, pethidine and epidural. I'm going to give you some more details for each option of pain relief, so when the time arrives, you can make your choice more easily. You may use a birthing pool if you meet the criteria as per the national guidelines for water births. The temperature of the water is controlled and it has a natural soothing effect which can take the edge of the pain away. The positions you adapt in the pool also help to reduce the labor pain. You may also be given gas and air when you're in labor. This works by inhaling a mixture of a gas called nitrous oxide and oxygen, which helps with coping with labor pains. You may experience some nausea or feel lightheaded when using gas and air in some cases, but it has plenty of advantages, such as allowing you to be fully mobile and is easy to set up and use. The potential side effects pass very quickly and there's no side effects on your baby. Your midwife may offer you pethidine while you're in labor. This is given as an injection and it starts working within 20 minutes to half an hour. Pethidine can take most of the pain away and also makes you feel relaxed enough to rest between contractions. In some cases, it may make the baby sleepy, therefore we avoid giving it to you when you're very close to delivery. However, if this happens, we can reverse the effects on the baby by using the appropriate medication. Another option of pain relief is the epidural. This can only be facilitated on the labor ward. The epidural is carried out by a specially trained anesthetic doctor who will site an epidural catheter using a special needle in your back. Through this catheter, the anesthetist can give you medication for pain relief. Epidurals are the most complicated method of pain relief, but they are the most effective of all. For an epidural, the anesthetist inserts a needle into the lower part of your back and uses it to place an epidural catheter, a very thin tube near the nerves in your spine. The epidural catheter is left in place when the needle is taken out, so you can be given painkillers during your labor. The painkillers are a local anesthetic to numb your nerves, small doses of opioids, or a mixture of both. An epidural may take 40 minutes to give pain relief, including the time it takes to put in the epidural catheter and for the painkillers to start working. It should not normally make you feel drowsy or sick and has hardly any effects on your baby. Having an epidural increases the chance that your obstetrician will need to use a ventouse, a suction cap on your baby's head, or forceps to deliver your baby. An epidural can usually be topped up to provide pain relief if you need a ventouse, forceps, or a cesarean section. However, it has not been shown to increase the chances of you having a cesarean section. Also, with an epidural, you are more likely to need medication to make your contractions stronger. It may also cause a drop in your blood pressure or make you feel itchy. Most of the time, you may find it difficult to empty your bladder, therefore your midwife will need to site a catheter, as it is very important to keep your bladder empty during labor. 1 in every 100 women is found to experience a headache as a result of the epidural procedure. This may last for a few days. If this happens, the anesthetist will advise you about the treatment you could have. There is no greater chance of long-term backache as a result of an epidural. Backache is common during pregnancy and often continues afterwards. You may have a tender spot on your back after an epidural, which rarely may last for a few months. Most people can have an epidural, but certain medical problems such as spina bifida, a previous operation on your back, or problems with blood clotting may mean that it is not suitable for you. The best time to find out about this is before you are in labor. If you have a complicated or long labor, your midwife or obstetrician may suggest that you have an epidural, as it may help you or your baby. The type of pain relief is your choice. You may decide to visit the NHS Choices website to find more information and discuss it with the midwife when you are in labor.